I would like to come to our next speaker, Professor Khuloud Al Jamal. She's from King's College of London. I know her for a while. And she's talking today about, she's head of the medicine development and the Institute of Pharmaceutical Science. And she's talking today about ionizable lipid nanoparticles in action. I think we heard a lot about that in the conference. And beyond delivery. And I'm especially interested, of course, in the beyond delivery part. So the stage is yours.
Good morning, everyone. So today I was trying to talk about things that are not very positive, but observational, what we found during our research using lipid nanoparticles for nucleic acid delivery. So if you follow our research, we have been for the past few years working on using lipid nanoparticles as a substitute for monoclonal antibodies for immune check blockade. So what we're trying to do is, is there a pointer here? No, okay, no problem. So you can see this is an image where you can see a number of immune check molecules. So you have the receptor and the ligand, you have the cancer cell or antigen presenting cells, and the immune effector cells. And this type of interactions can lead to either activation or suppression of the immune system so that the cancer cell can hide very well from our immune system. We're interested in modulating this immune check blockade process, so we can either boost the expression of the stimulatory one or silence or knock out the bad ones, the negative immune checkpoints. So we have been trying with various molecules to validate their applicability as therapeutic molecules because different types of cancers may respond differently depending on how their immune environment transpire. So we have been using different types of nanoparticles to deliver either siRNA or mRNA or plasmid because we feel they have their own advantages and disadvantages. And you can see from this scheme that you want to deliver them to different sites in the cell, either the cytosol or the nucleus. So we've recently published, a few years ago now, a proof of concept study where we can reprogram the melanoma solid tumors by delivering OX40 ligand mRNA and siRNA for PD-L1. And we found that by doing this combination therapy, you are able to activate the immune system and actually eliminate the tumor and vaccinate these mice against tumor recurrence. So in this study, we hypothesized that if you silence PD-L1, which is in the faint color here, you're stopping the activation of the T cells when it binds. The binding lead to inactivation of the T cells, and then when you block these interactions, you lead to T cell activation. And when you express the OX40 ligand on the cancer cells or antigen-presenting cells, you kind of also boost this T cell activation and proliferation. So the challenge here was really to co-load a small nucleic acid like siRNA with a big one like mRNA. So we optimized the loading method where we are able to equally load them successfully with encapsulation efficiencies that's above 80%. So this is just an image showing, this is a cryo-freeze-dried image for our lipid nanoparticles. So this was the surprise. So when we looked at transfection of the J774 as a model macrophage in culture, where we wanted to co-stimulate or overexpress the OX40 ligand, which you can see has been successfully done with the combination nanoparticles, we found undesired overexpression of PD-L1, which is actually the immune checkpoint that we would like to silence. So the first observation was the dark gray color, where we use negative mRNA for mLuc and the siRNA, and you can see there is high expression of PD-L1, comparable to what you get with the LPS. We also looked at the activation, and we found regardless of what you put in these lipid nanoparticles, whether you put your specific nucleic acid or scrambled one, you also have activation of the macrophages, so you have high expression of CD80 and CD86. So we didn't neglect that, but this was to us at that time a problem. we did the therapy study, and we also noticed there is delayed tumor growth with the non-coding lipid nanoparticles. Not as good as the one with the SI-PD-L1 and OX40 ligand, but it was there. When we looked at the immune environment, we can see that there is higher infiltration of CD4 and CD8 cells, both in the tumor and in the tumor-draining lymph nodes. But the activated ones are more prominent when you have specific nucleic acid. So we thought this is a good thing. So what the negative nanoparticles are doing are infiltrating, increasing the infiltration of the immune cells, but actually the activity and what we want to happen happens only when you have the right sequence. So at the same time, another PhD student of mine, she's on the call now, Dr. Kent, she's finished her PhD, and she was working on plasmid delivery as opposed to mRNA delivery, because there are some advantages. It's cheaper, it's more stable, and it has its own immunogenic characteristics. So maybe it's actually more useful for cancer immunotherapy. And what we found when she compared the PI, lipofectamine, and lipid nanoparticles for transfixion, we found also there is higher expression of PD-L1, more particularly noticeable for the lipofectamine. We looked into this further, but in this time we replaced the plasmid with a GPC, which will bind TLR9 but will not lead to its activation, because we don't want to have this effect as an immune activation. We really want to discriminate what does the plasmid delivery do as a backbone. And what we found, you see the black color, which is the complex, versus the light gray, which is just the transfixion reagent. You can see there's high PD-L1 expression, and this is non-coding. This is purely non-coding plasmid. But there is higher expression when you have the complex, which does not exist when you have the transfixion reagent alone. The lipid nanoparticles on the other side did not show this phenomena. So this was good for us, because Frida wanted to silence the PD-L1. When we correlated this with toxicity, so the graph on the left-hand side, you can see the lipofectamine and the PI complexes are toxic, but not the SNALPs, stable nucleic acid nanoparticles. And the transfixion reagents on their own, they don't show effect on viability. So something really happens when these LNBs complexes traffic into the cell. The reviewer asked us whether this is related to apoptosis. So we really looked at the cell population. And what you can see is when you have the complex, you have higher population of late and early apoptotic cells. And when you look at that PD-L1 expression on these apoptotic population or the cells, you find when you have the complex, there's also higher PD-L1 expression on the live or the early apoptotic population. So there's some correlation between apoptosis and increased PD-L1 expression. So then the reviewer also wanted to know if all lipid nanoparticles behave in the same way. So we then compared other types of ionizable lipid, because our first study was done with the MC3, and we know from our handling that KC2 and C12 lipids are more toxic. And we did find a difference, because the KC2 complexes, the black bar, has higher PD-L1 expression, so is the C12, and that correlated nicely with the toxicity of the complexes versus the LMPs. So we kind of concluded that there is a correlation between cytotoxicity and increased PD-L1 expression, but we wanted a nice ending to the story. So we thought, what happens when we introduce SI-PD-L1 instead of the negative siRNA? And we could actually reduce the expression back to its normal level. To us, this was an interesting story, but when we showed this to a clinician, he actually said, it's good that you have increased PD-L1 expression, because maybe this patient population can be susceptible for treatment using monoclonal antibodies. So it's interesting how people look at it from different angles. Anyway, the main aim of Frida's project was really to go in vivo and induce cancer immunotherapy using a mixture of immune checkpoint blockade. So we went with in vivo studies knowing that the plasmid lipid nanoparticles has effect on their own. They're non-inert and they're also potent immune activators. So initially, we looked at different types of nanoparticles, but this study was done initially with a KC2 lipid, and we profiled the uptake of the LNBs in the immune cells and the cancer cells in the tumor, but also the tumor-draining lymph nodes. And we know this is intratumoral administration. We are interested in intratumoral administration throughout, and we can see there's wide distribution in the tumor cells, and there's also drainage into the tumor-draining lymph node. When we look at the therapy, you can see with the dose escalation studies, there is already delay with the non-coding lipid nanoparticles and starts from very low concentration as low as 1.6 microgram per tumor. This is dose dependent, and we can see a difference. The threshold is about 6 microgram per ml, and that was quite interesting. We looked at the immune population. You can see there's more CD8, more CD4 in the tumor, and there's also more dendritic cells, both the tumors and the tumor-draining lymph node, and you can see that pattern with the dose response. When we looked at the CD8 and the Treg population, the tumor-draining lymph nodes, we didn't see an effect. And this is important because I will show you what happens when you introduce the immune checkpoint blockade to the treatment. This is the survival study, and we looked at different types of ionizable lipids. So you have the MC3, the KC2, and the C12, and this observation was actually persistent, where you have improved survival with the negative nanoparticles regardless of the type of the ionizable lipid used. Is this plasmid DNA dependent, or does it really happen when you have the siRNA? So with the survival study, we concluded that the plasmid DNA is better than the siRNA in delaying the growth, similar to the study we've seen in our ACS Nano using the non-modified mRNA. So if you compare them, plasmid complexes, you follow with siRNA and mRNA. So the siRNA and mRNA themselves also have an effect, but not as good as the plasmid. So I told you we're interested in combination therapy for immune checkpoint blockade. So then we exchange the negative nucleic acids, non-coding, with coding one. And here we're interested in two targets, IDO, which is an intracellular enzyme that catalyzes the degradation of tryptophan, and the final effect is activation of the Treg cells and inhibition of the effector T cells. Overall, that gives you a reduced anti-tumor response. So what we would like to do is deliver an SI-IDO and an MOX40 ligand to reverse that. This is how the tumors look like. So when you have the best results we got was with the POX40 SI-IDO, and the negative LNBs also had an effect, slightly worse, but it's also very good. And when you look at the immune profiling, this is quite interesting because you can see the elevation in the immune cells in both treatments, but when you have the specific nucleic acids, you have higher CD4, which we expect as a result of OX40 activation. You also have a reduced Treg in the tumor-draining lymph node, and you have also more antigen-presenting cells in the lymph node. This is how the survival study looked like, so the spaghetti growth curves, and what you can see that about 10 to 20% of our mice that received the OX40 ligand actually had full survival. We re-challenged them, so you can see the graph at the bottom and the one next to it, where the naive mice actually showed the tumor growth, but the one that were retreated with the lipid nanoparticles did not show it, which shows there is a memory response and also protection from the tumor recurrence. Why some mice responded better than others, this is something we need to look into, and that reflects also the heterogeneity of the disease. So we have some take-home messages here. We should not consider ionizable lipid nanoparticles as inert. They're not. We also think the nature of the cargo in these LNPs can matter. And we still believe that if you have immune checkpoint blockade in these LNPs, this can still offer advantages in terms of specificity and tumor protection. So finally, I would like to thank mostly the main contributors, Adam and Frida, who contributed to the work, the rest of the team, and also the funder and also my collaborators. Thank you very much.